had a list of about 15 herbal supplements giving the child.
Yeah.
And child has a sarcoma of the leg. It spread to the lung. She started on herbs. And now instead of one metastasis in the lung, there's 2 metastases in the lung. She had surgery on her liver to remove the metastasis. On herbs, there's now 2 more metastases, including a recurrence where the surgeon cut. So probably the surgeon cut and he spread the cancer cells, and probably the herbs and spices didn't exactly help her. And now there's testing on those herbs that you're buying, that many people are buying. My father wouldn't be buying them because he doesn't believe in spending money without proof. So there's something called DNA barcoding, and it's a kind of work that's being used, for example, on fish when they sell you a sea bass, and they say it's sea bass, but in fact it's I don't know what.
Right.
You know,
some
kind of cheap fish.
Yeah.
And with this barcoding, they can do analysis of the fish and tell you, are you really buying salmon, or are you buying something else that looks like salmon or sea bass or whatever. And they're using the same genetic fingerprinting on these herbs. So researchers bought 44 bottles of popular supplements sold by 12 companies in the United States and Canada. And many of these herbs were not what they claimed to be. They were entirely different. In fact, some were replaced entirely by soybean, wheat, and rice. So you can imagine you can buy a little bottle the size of a pill bottle of so-called herbs for 10 or 20 or 30 or $50, and it's all processed rice or wheat or soybeans. It probably costs 2 cents.
Right. I mean, it's unbelievable what
and people are supposedly staking their life on these herbs, which, number one, don't have any basis anyway, and number two, they're not even the herbs that you think you're buying.
Right. Yeah.
So in a substantial proportion of patients, there were no herbs whatsoever, only fake product. And in other bottles, the herbs were greatly diluted. So instead of being pure XYZ, they were diluted by 90% or 80%.
It makes production of those products much less expensive.
Well, it's called fraud.
Yeah.
And first of all, I do not advocate herbs. Number two, it seems that people who are buying herbs are being misled as to the potential benefits of those herbs. And number three, it seems they're not even getting the herbs that they think they're buying.
Yeah.
So be careful. Be careful. It's another betrayal of people, and $5 billion a year is a lot of betrayal.
That sure is.
So please, hold on to your wallet, and let's talk about how you're going to manage your cancer care. Let's do things that are scientifically proven. Let's talk about those vitamins. Let's talk about those herbs. Let's talk about sugar and acid and base. I would urge you to call us up or come in for a consultation, and we can get some straight talk to make you better with treatment that has scientific basis. So we're going to go to hear a word from our sponsor, who is the man with the golden voice, and we'll be back with more news. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, we're back. It's Dr. Lederman. We're talking about cancer treatment. We're happy to take your calls. We're happy to see you in our office, which is only a few steps away on 38th and Broadway. We have Dr. Eisen on the line. Dr. Eisen is a radiation oncologist, born in Argentina, fluent Spanish speaker, who I think wants to talk to you about skin cancers and radiosurgery. So good morning, buenos dias, Doctor.
Buenos dias. How are you?
So you're going to talk to us today about your Spanish-speaking patient, and he's had multiple surgeries. He's had twice surgery, and now has a recurrence of basal cell or squamous cell in his nose?
Basal cell.
So there's a basal cell in his nose, and it's very extensive. His nose, I saw him with you. You introduced him to me, and he has very extensive disease. He's had surgery twice, and it didn't work.
And that's one of the problems, because sometimes it's not just only for the cosmesis, but people are thinking that...
Well, cosmesis is important. I mean, that's why people come to us. They want to be cured, and they want to have their nose. Right. I mean, if he went to have surgery or Mohs chemosurgery, he'd probably lose most of his nose. They'd start cutting, which is what Mohs does. And he has a very particular surface to the nose. We all do, in fact. And when they start cutting off the nose is the first thing people see when they meet another person.
Now, doctor, your treatment of radiosurgery, that would not affect the appearance?
Probably his nose would look better, because you'd probably end up getting rid of a lot of the irregular skin and cancer.
Okay, wow.
I agree 100%. And the second thing is that sometimes people are thinking that skin cancer is something that it's easy to take care and just...
Well, it's easy with us if they come to Radiosurgery New York, because we're so effective at it.
Because skin cancer actually can keep coming back and back, and then...
because people that have skin cancers usually have had sun exposure, and usually there's other areas.
So he was very, very happy, because we are going to develop a program exactly like custom-made.
Well, we have a program. We have a program called Radiosurgery, and it allows us to hit the cancer, not hurt healthy tissues. Our success rate is very high. We treat a lot of cancers of the skin of the face, the ear. I had a man this week. He actually heard us on the radio last week. So a businessman, very professional businessman, came with a mass on his ear. You had this man with, I think he had 2 basal cells on his nose, correct?
Right, 2, and it keeps coming, and that's
actually he had another cancer on his neck. So these people are at risk, and we encourage them to come in, because you can give them a great result.
So they were extremely
most likely
happy also, because they had a chance to discuss everything in Spanish. That was very important, particularly because the family members also, they were able to interact everything in Spanish. They were very happy because we were able to go over every single report. So it was a great moment, not just only to let them know exactly what we do, but also be able to go in detail with the whole consultation in their own language. And
it's very important. It's very important for listeners to know, if you've got a suspicious lesion in your skin, please come in and see us or see your dermatologist. Before you get cut, you might want to seek other options, including non-invasive, non-cutting options. So it's a teaching point, especially around the ears, eyes, nose, and mouth. Those are areas where surgery is very hard to recreate what God has given us.
So I just want to leave my telephone number for, so my number is 917-836-8105. for the Spanish-speaking community,